I don't go out now because of the smell, and my bandages look so awful with the discharge on them. The pain in my leg is terrible, and I can't sleep soundly. I look and feel horrendous. I'm so lonely and depressed. I don't even feel I can go and see my closest friends. Sometimes I have to sleep in a chair with my legs up because of the pain. My husband is very good, but I know he finds the whole leg ulcer thing disgusting, and that's how I feel. The GP practice has tried to cure me, but they haven't got the time or the equipment to do so. I can see my leg being eaten away. I'm in despair, with little or no hope. Is this what I can look forward to for the rest of my life? We've had a lot of these feelings expressed during the last 2 days. And this was me in 2007. And as most of you know, these feelings are typical of the misery and pain so many men and women suffer every day. 2 people in every 1,000 have lower leg limb problems, and the prevalence is 4 times greater in the over 65s, and this is a growing problem. Fortunately for me, I was referred to the Leg Club by my GP surgery. I am pleased to tell you that within 12 weeks of being treated at the Leg Club and doing what I was told for a change, my ulcer had been cured, and I had felt I'd been given back my life. The Leg Club had the equipment and the time. The GP surgery didn't. As a small thank you to the Leg Club, I have now worked for the last 6 years as a volunteer twice a week in 2 leg clubs. So having had the experience of being cured by a leg club, I have been asked to speak on the subject: are patient hopes and expectations realistically achieved? Well, I can say mine were, but what about all the other leg clubs and other members? I decided the best way to find out the answer to the question was to ask members of other leg clubs about their experience, and to do it by sitting down and listening to their responses whilst respecting their confidentiality. I have found that many older patients, and they are in the majority, don't like filling in forms. And I have found that most patients will give a candid, sometimes more than candid, opinion if they don't have to write it down. And it was honest opinions I was looking for. To gain information direct from patients, I visited 4 leg clubs, 1 in Wales, 2 in the West Midlands, and 1 in East Anglia. The average age of the patients I spoke with was 77 years, and the split was 50% men and 50% women. The oldest was 94, and the youngest 35. I now invite you to hear what some of our patients actually said about their leg club experience. Some patients who made comments had just started treatment. Some had been in treatment for a long time. Some had been cured. And by listening to their words, we shall learn more about their thoughts and whether their hopes and expectations are realistically achieved. I first spoke to a man aged 35. He had had 6 months treatment at the Leg Club. When I first saw him, he said, "My ulcer was very painful and intrusive to living a normal life. My treatment has been working very well for me. My ulcers are better now than in previous years. I'm hopefully coming to the end of my treatment." He went on, "The Leg Club has given me confidence in the nurses and being able to live a normal life whilst continuing treatment." In answer to the direct question, "Have your hopes and expectations been realised?" he replied, "They will be when my ulcer is finally healed." When questioned about the goods and the bads in his treatment, he replied, "I would prefer to be seen in private whilst receiving treatment." Since I originally spoke with this man, he has been declared cured. When I saw him again after his cure, he said, "They've managed to heal my ulcers and given me back my independence. Success." I met a man aged 88 who had been with the Leg Club for 4 years. He said, "I have a leg ulcer and sometimes the pain is acute, but I will support the club in every way. I enjoy the social side and I'm happy to be treated in the room with other patients. I am very grateful for the treatment we receive, the professionalism of the staff, and the standard of cleanliness. His treatment is continuing." The third patient I met was a lady aged 56. She was in the middle phase of her treatment and had been attending the Leg Club for 9 months. She had been advised to attend the Leg Club by her practice nurse. Her wound is now dry and beginning to heal. The nurses explained everything. They have been taking photographs, couldn't do more. Nurses, all lovely. The time they spend with you is much longer than at the surgery. I asked the question, "What's good about the club for you?" The friendliness and how nice they are to people. The club has done so much for me already. A man aged 64 has been with the club for 1 year. My ulcer is much better, but not yet healed. However, after 5 years of going to the GP, I was referred to the Leg Club. Now I have good days and bad days. In answer to what's good and bad, he said, "Good coffee and chats. I wouldn't be able to cope without the Leg Club. I live on my own and I was an only child. Great that we don't have to make appointments." Bad? Any comments? I don't think there are any. I then met 2 ladies aged 91 and 88. They wanted to speak to me together, for they had become great friends and shared much banter, and always sit together. The 93-year-old had had leg ulcers for 6 years. Their comments were, "Leg ulcers come and go, but they're not getting worse. At our age, we just have to deal with what we have. We have nothing to complain about." Oh, what wonderful ladies. They teased each other unmercifully. A 70-year-old man had been at the club for 8 weeks and had an ulcer caused by a blister after wearing new boots. He said, "I'm nearly cured already, but I couldn't be cured without the Leg Club. 2 more weeks should do it. It's the compression bandages. That's what's done the work. Lost night's sleep all the time until pressure bandages were applied. The girls, the nurses, here are fantastic. On my first visit, I felt very down. Once nurses started treating me, I had no more worries." Other comments? I just hope there is always a Leg Club for people like me. A 79-year-old man had been with the club for 8 months. He had an ulcer which started with a blister. He said, "I'm improving since coming to the Leg Club. I look forward to coming to meet people. It would be awful without the Leg Club. I don't know what I'd do without it." It's a bit of a laugh too. It's the only time some people like me get out. Another lady, aged 79, she had varicose foot ulcer and had been at the Leg Club for now 8 months. She had had her ulcer healed, but is receiving treatment for 2 small chilblains. She said, "1 chilblain is healed, now I've got 1 to go. I've made friends at the club and I like to keep in touch with them. I also like the outings." In answer to the question, what's good about the club, she replied, "The staff are so busy, but are still cheerful. What's bad about the club? Acoustics of the room make it very difficult to hear." I learnt later that this lady was somewhat deaf anyway. A 72-year-old lady said, "It is very helpful to talk and helpful to share experiences." For her, that was enough to make her pleased to be at the club and to be given confidence that she would be healed. A lady aged 79 had been with the club for 6 years. She said, "I had the worst legs the nurse had ever seen. My legs were discharging all the time, but not now. I'm cured." She also said, "The Leg Club is my life. I wouldn't be alive if it wasn't here. I have no need to come, but I still do. I had a Doppler. It was such a help, and it really proved to me what was wrong and if there was a chance of healing." A man who did not give his age, who was a new member and had had a Doppler test, said, "Highly satisfied so far, but would prefer to be seen at home." A man aged 76 had been with the Leg Club for 3 years. 1 ulcer healed, 1 ulcer still to be healed. He only said 3 words, and that was, "The Leg Club's brilliant." A 93-year-old lady who had been at the club for 6 years has her legs washed and massaged. She said, "I think the Leg Club is wonderful, and I have nothing but praise for them. It's my life." A man of 83 had 1 leg healed, 1 to go. He said, "I don't know what I'd do without the Leg Club." He followed it up with an unsolicited remark. "Doctor at the hospital didn't know what to do with my legs or how to do it." A very interesting patient, aged 71, who has attended the Leg Club for about a year, told me she was burnt on the leg and foot with sulfuric acid. This is what she had to say. "My burns would not heal. A practice nurse suggested the Leg Club. Now I am healed. Couldn't do without the Leg Club. Nurses were wonderful, curing an injury I'd had for 5 years. The nurses at the Leg Club know what they're doing. I've no pain now. Had a Doppler, such a help. It really proved what was wrong and if there was a chance of healing." So, can we summarize where patients' hopes and expectations have or have not been met? Firstly, I'd like to give you examples where patients' hopes and expectations have been met. Professionalism of the nurses. It has given sufferers hope for a cure. They see it all around them. It's easier than at a doctor's surgery. Appointments not necessary. Nurses explain everything. They make time to do it. Coffee and chats make patients feel welcome. Sharing experiences is so very helpful. Love the outings and the social life. I wouldn't be alive if the Leg Club wasn't here. Where hopes and expectations have not been met, prefer to be seen individually while having treatment. Don't really like to be seen having treatment. Not sure about being treated in a room with other patients. Acoustics of the room can make it a bit difficult. Let us now look at the Leg Club's stated aims, which are as follows: to empower patients, meet social needs, rebuild self-esteem, facilitate an informal network, provide an informal forum for healing the promotions and education, and above all, where possible, to cure and check on cured patients. I think you will agree that the patient statements we've heard today give a resounding yes to all those aims. Conclusions. Patients' hopes and expectations are only realistically achieved when the patient has been cured. Many of the 70% of patients who have been cured had given up hope before being referred to a leg club. Of the remaining patients, up to 30% will not have their hopes and expectations realized due to their age, lifestyle, or overall physical condition. However, we hear from patients' replies that even those who still suffer from lower leg limb problems and are still being treated, some of them 5 years or more, are immensely grateful for the care and expertise of the nurses and the friendly environment of the clubs. They feel looked after and cherished. This inability to cure certain patients due to their physical condition brings to the fore the need for the focus of well-being to be part of a leg club overall package for patients. If all focused on well-being as well as healing, expectations would be met more frequently. The Lindsay Leg Club aims are obviously right. Patients' endorsements could not be any stronger. The Lindsay Leg Club should therefore keep doing all the things that are getting such a strong response from Leg Club members, nurses, volunteers, and the treatment is in the eyes of the patients quite excellent. Their comments tell the story. The critical comments received were reserved for the lack of privacy during treatment. I can relate to this from my own experience when first visiting a leg club. It was a bit of a shock to see other people's lower leg problems. However, I also agree with the nurses who have told me that the majority of people do get used to it, as I did, and that it can give patients a chance to exchange their hopes, fears, and successes. The possible solution to the worries of privacy could be to provide enough screens where appropriate during treatment. I know this has been achieved in some clubs. I now believe this should be considered at national and club level to alleviate this criticism. Having heard the minimal criticism made by leg club members, as opposed to the general favourable comments of the majority, is it not a huge tribute to nurses, the volunteers, and does it not suggest the success of the Lindsay Leg Club model versus other methods? Therefore, is it not important to increase the number of leg clubs across the UK for the benefit of the multitude of lower limb sufferers who endure such miseries with little hope of a cure? It so upsets me when I meet people with lower leg limb problems who have no Lindsay Leg Club near them, where I know they could be helped and probably cured. A postscript. I hope conference will allow me this short postscript. During my time travelling around leg clubs, I've come across serious concerns about the NHS including leg clubs in their future plans. The NHS seems to be in a constant state of change, as we've heard at the present, so it is vital that the Lindsay Leg Club Foundation anticipates NHS changes in any new plans. close liaison with the NHS at government level is essential, but so is close and immediate communication with local leg clubs. Some clubs may feel they are in danger of closing due to the NHS support being withdrawn, and I believe one has already been closed. The benefits of leg club treatment need to be further and loudly publicised to the NHS at national and local level. Seen from the leg club level, benefits are: large numbers of patients can be treated in one place. Nurses' time and travel expenses are reduced per patient. Treatment at leg clubs is effective in curing the majority of patients, so they no longer require NHS support, thus saving the NHS money. Leg clubs provide specialist treatment as a result of combined nursing expertise and specialist equipment. Patients learn how to help themselves and be part of the healing process, again speeding up the healing time and saving NHS money. I hope my comments are helpful and useful, and that action is taken, for our leg clubs could be in danger, and the opportunity to carry on this wonderful leg club work must not be lost. Finally, I want to say a thank you to all the wonderful nurses who have helped me personally, some of whom are here today. To Ellie for developing the Lindsay Leg Club model. To Roland for editing my talk and being my acting director. And as Ellie said yesterday, to Lynn Bullock, who's always in the background doing a wonderful job for us all. Thank you for listening.